Dear friends, we are going to talk about today laparoscopic management of appendicitis. As we know that appendix is one of the organs in the abdomen. Whenever there is a inflammation of appendix, it is called appendicitis. And lot of time we need to remove that appendix to cure the patient. And when we remove this appendix, it is called appendectomy. Conventionally, this used to be done by an open method where we used to make a big cut in the abdomen and remove. Today we can do this by minimal invasive technique or laparoscopic technique, where we go inside, see the appendix, free the appendix from surrounding structures, we cut the blood supply of the appendix and then remove it. By laparoscopy, there are a lot of advantages to the patient and to the society and to the healthcare system. There is a minimum pain, there are 2 or 3 punctures which are hardly visible, so cosmetically it is much better. The stay in the hospital is much less, there is no wound infection, and there is very less chances of hernia. Patient can go back to work much faster. So in a country like India, where people are dependent on labor, the breadwinner, if he is undergoing surgery, he can go back to work much faster and quicker. Supraumbilical site, we are making a small cut here, which is around 1 centimeter. We are now introducing a needle inside the abdomen. This is to create space inside. We will insufflate with gas, carbon dioxide. So we will have sufficient place inside the abdomen to work around. Once we create enough space through this maneuver, we will insert our camera, which is again of 1 centimeter diameter, and that camera will give us a vision onto the TV screen. Sharp नहीं है आपका? शार्प है? अंदर सब साफ है ठीक से? नहीं, गर्म पानी से क्या कनेक्शन है इसका? ट्रोकार स्कोप वगैरह ये सब वैसे ही है?
हाँ सर, सेम है, सब कुछ सेम है।
This is a trocar which we have inserted, and through this trocar we will put our telescope, and you will get a vision of inside. साफ करो, हाँ साफ करो. इसको लाइट को ज़रा ऊपर कर दीजिए. देखो कैसा साफ तो नहीं है. देखो यार महेंद्र, कुछ उसका वहाँ पे वो अपना लाइट वाइट कॉन्ट्रास्ट. हेड डाउन और कर दीजिए. बस राइट अप कर दीजिए. बस ठीक है जी, थैंक यू. We have created another port of 10 millimeter in the suprapubic area. This is a working port. Then a ball grasper, please. This is cecum. That is the terminal ileum. Here is appendix. This is the appendix, you can see it is retrocecal. Okay. We are going to make another port in the right iliac fossa. Since this patient is on blood thinners, we need to be careful regarding the bleeding. Harmonic लगा लो मैडम. Eye grasper. Sony session. This instrument which I am using in my right hand is a next generation energy source. As we were discussing, because this patient is on blood thinners, we have to be careful about the bleeding. So we are using advanced energy sources to make sure that the patient does not have bleeding. So we are mobilizing the cecum, the lateral wall of the cecum from the peritoneal wall. There's some fog on the screen. उधर से दिखाओ. सिल्क रेडी रखना ना. थ्रेड. लाइए सिल्क. So we have made a window around the base of the appendix and we are tying it with the silk thread. So whenever you encounter a difficult appendicitis, it's better to go on the base first, tackle the base, and then move ahead. As you can see, the appendix is densely adherent to the cecum. So we are now moving from the base towards the tip, and using this next generation energy source, we are tackling the fat and the blood vessels which are coming onto the appendix from the mesocolon side. Scissor please. एक और लगाना है क्या रवि? है? मैं कुछ जो टच हुआ है? हाँ। वो तो कुछ नहीं रवि।
होगा नहीं तो इससे काट दो सर, ये भी तो सील कर देते हैं।
नहीं नहीं, इससे नहीं काटेंगे, इससे काटने से वो लूज हो जाता है यार। एक लूप और लगा सकते हैं इफ यू वांट, हैं? एक लूप, हाँ। So we are trying to double secure the base of the appendix by using another method which is called endo loop. These are pre-formed loops which can be used in a situation where it is difficult to tie a knot, or a person is not used to of tying a knot. So as you can see on the monitor, this is a pre-formed loop of catgut. And we are trying to negotiate this loop to the base. Scissor please. So we have cut the base of the appendix. Now we are going to remove this cut appendix through the 10-12 millimeter port. We should take adequate care of not touching the appendix to the body tissues, especially at the entry wound. So we are going to withdraw the appendix into the port and take it out. as you see here. This is the appendix. Show inside. ड्रेन तो नहीं डालना, कहाँ गया रवि? So we need to make sure that there is no bleeding. As you see here, there is no bleeding here. Grasp. Okay, show this. निकाल दो, ये दिखाओ. And we have withdrawn the ports. Bleeding period. Cautery. लगाया हुआ क्या? इसका तो बहुत बड़ा बर्न है आपका, जो पोर्ट वाले साइड पे आपका तो हल्का सा बर्न हो गया, बहुत बड़ा बर्न है. तो रो रही है दर्द से, कैसे हुआ था वो बर्न? हैं? क्या जवाब देंगे? उसको निकालना चाहिए था या तो आपको बर्न साइड को. Thank you, thank you. Yeah, you can see here the ports. Is it visible port here? So these are the 3 ports. They will hardly be visible once the healing takes place, and this causes minimum pain. Patient is back on his feet after a couple of hours, and he is allowed to drink after 2 hours, and he will be discharged tomorrow. This is the advancement of minimal invasive surgery. It has avoided the large incisions and prolonged hospital stay, which leads to a lot of morbidity in patients.